cancer is such a word which brings lot of anxiety and apprehension when we say that a patient is diagnosed with this, either to an individual or to a family or to the society, because there are a lot of myths and fear associated with this, but equally there is lot of change in the management aspect or detection aspect or the advance in the technology of surgical or medical or radiation oncology treatment related. So, on this day of World Cancer Day, that is February 4th, we are going to discuss about the changing paradigm in the management of cancer care. To highlight more and more about this, I am Dr. Rajashekhar C. Jaka, consultant surgical oncologist at Manipal Hospital, Whitefield, and also I have my colleagues along with me, Dr. Vinay, who is a consultant pediatric hemato-oncologist and bone marrow physician. Welcome, Dr. Vinay.
Thank you, Dr. Jaka.
I also have Dr. Abhaya Kumar Malbagi, who is a consultant medical oncologist at Manipal Hospital, Whitefield. Welcome, Dr. Abhaya.
Thank you.
We previously had a lot of difficulties in treating the cancer because genetic mutations were not known and targeted therapies were not available, but at present there is a lot of change. Every day we see that there are a lot of drugs which are coming into the market. Every day we see a new drug coming into the market, and in the surgical aspect we have a robotic surgery which is very advanced. We have HIPEC, that is hyperthermic intraperitoneal chemotherapy. We have chemoport insertion which gives lot of comfort to the chemotherapy patient to decrease the side effect and for the comfort and quality of life. And there are so many advances, so which I would like to tell you, so that we do not have the fear of treatment, because most of the times what I have seen is the fear of treatment itself keeps the patients away from the timely management. So, let us discuss more about this. To first know about this pediatric malignancies, majority of the population, public, they think that cancer does not affect children. So, what do you say, how common it is and how different it is from the adult cancer?
It's very true, Dr. Jaka, that most of the times when parents see me with a child with cancer, they say, how can it happen in a child? So, world over, close to 4 lakh children are diagnosed each year with cancer. I always say childhood cancer is a paradox, in the sense it is not common, but as a pediatric oncologist, I see it day in and out, close to about 100 cases in a year. So, although not a common problem, if we see the leading cause of death beyond infancy, beyond 1 year of age in a child, cancer comes in one of the top 3 causes. At the same time, fortunately, in childhood cancers, if we treat the child appropriately and in a timely fashion, the outcomes are excellent.
It is more of a timing in a treatment.
Timing, I would say early diagnosis, time and appropriate center and the medical team that takes care of the child is what actually comes out as a result. So, childhood cancers are not common, but it is not unknown. At the same time, if diagnosed early and treated timely, appropriately, outcomes are excellent.
Do you feel that the incidence of now pediatric cancer is increasing?
So, the incidence as such is increasing because we are able to diagnose more and treat them more. There is something called cancer registries. So, the cancer registries are now more active and they are able to get in the cancer diagnosis all over the world. So, if we say about 4 lakh cases are diagnosed each year in the world, close to 1/4, that is 25% diagnosis of childhood cancer happens in India. India being such a wide populous country, I feel that that percentage that is reported is still underreported, and maybe our numbers are even more. So, in years to come, as our awareness of cancer in children increases, more and more registry data comes out and it seems as though incidence is increasing, but this has been before. The other thing that I would like to stress, in the last era, about 2-3 decades ago as well, infectious cause for childhood illnesses were more. Right now, we have overcome that with lot of antibiotics and hygienic methods, vaccination. This is the era of non-communicable diseases in which cancer is one of the leading cause. So, I might say there has been a shift with an increase in the incidence mainly because of more and more reporting of cancers in children.
Yes. Let me speak to Dr. Abhay because we have seen recent statistics where it is said that there is an increase in the cancer incidence. What is your take on this?
Yeah, definitely there is increase in the incidence of cancer, and if at any one time if you take that is the prevalence of cancer is increasing in society, there are a lot of reasons for that. So, one is that majority of the patients, especially in western countries like US, they are undergoing screening programs. Because of screening, lot of malignancies are detected, and that is one reason. So, other reason is that, so since because of the people now surviving so longer period of time. So, cancer is especially disease of elderly people. So, because of longevity of survival, so some malignancies are identifying in elder people. So, other than that, lot of other causes, so like around 5 to 10% genetic causes also we can see in cancer. Other than that, we have environmental factors, especially like consumption of alcohol, smoking, so consumption of tobacco. So, these are also important risk factors, and inactivity and what is consumption of the food. So, which is most of the times is contaminated food. So, with lot of use of chemicals. So, all these factors might have contributed to increase in the incidence of cancer.
Yeah, that is true, because recent statistics released by ICMR also says that there is 11% increase in the cancer incidence which is going to happen by 2025. So, definitely there is an increase. Of course, with the diagnosis, the this one screening methods have improved, but still as such cancer incidence itself is increasing. That is what the statistics also says, and when we were in a childhood we hardly used to hear about this, but now it has become so common that every one of our relative or one of our friend we hear that okay, they are suffering from cancer. Now, we also have seen that there is a lot of change in the treatment aspect, because what was there 10 years before is not now. We never imagined that we will be able to operate with a robo on a patient. Now, the technology has advanced so much that we are able to operate a complex surgery in a pelvis, like for example, rectal cancer or uterine cancer, bladder, prostate cancers. All these cancers we are able to do with a lot of precision, because it is not about minimally invasive or the decreasing the scar to a patient, but we are able to remove the appropriate tumor without damaging the surrounding structures. This has really revolutionized the world of surgical oncology, and probably in future when this becomes wireless, probably we will be able to operate anywhere in the world by sitting in Bangalore or sitting in any remotest of village, we will be able to operate in any bigger cities. So, that kind of change in technology has come down, and even we are able to decrease the complications. So, on this aspect I would ask Dr. Abhay that how this chemoport is going to help a patient to decrease the complication of a chemotherapy associated.
Yeah, see normally, so we administer chemotherapy. There are two ways of administration. One is using the peripheral line, so other one is using the central line. So, many of the chemotherapy medications, they are irritant to skin. If there is any swelling which will come in the hand, or if there is a medicine will go into the subcutaneous tissue, so it may damage the skin. So, there will be difficulty in healing, or healing may take longer time. So, for that purpose, so we are using many patients central line. So, central line again there are two ways. So, one using central catheter, another one is using chemoport. So, if central catheter if we use, so we call it as either peripheral line or central line. So, there is a more risk of infection, because some part will be outside. So, their patients frequently require dressing, frequently require flushing, but chemoport is entirely different technique. So, where we insert a chemoport into the central line, but here so port is totally inside the body, and hence there is no more risk of infection, there is no risk of blockade, and no frequent it does not require frequent flushing, and it is very easy for administration of chemotherapy or any other medications. It is very more comfortable to the patients.
True, because we have seen this the change in the quality of life after inserting the chemoport. Chemoport is a small device which will be inserted below the skin under local anesthesia. When we do that, patients are so comfortable, pain is very less, there is no staining of the veins or the skin, there is no ulceration, and because we know that cancer patients are already having lot of anxiety, depression, and the morale is low. In that case, if at all we are going to prick them at every time they come for the chemotherapy, they will have a lot of agony and pain, because majority of the patients I have seen telling that chemotherapy is painful, but chemotherapy is never painful. It is only the side effect which causes the thrombophlebitis or damage of the veins which causes the pain, or repeated pricking will cause the pain. So, that can be definitely be avoided. And also I ask Dr. Vinay regarding pediatric malignancies, how we have changed in the management of late recently. Is there any more advancement in the management of a pediatric cancer?
As a whole in the oncology world, we have moved a large, more than a mile now in the last decade with the advancements in technology, the precision, and the way we are approaching a patient for treatment. So, in pediatric cancers as well, there has been a lot of changes. So, it used to be the most commonly the treatment options are chemotherapy, surgery for few of the tumors like solid tumors, and radiotherapy for less number of patients. With the innovation of cell therapies, something like CAR T cell therapy and immunotherapy, we are now able to do a targeted treatment and thereby completely abolish the minimal residual disease in the body, the minimal residual cancer or the microscopic disease that is there in the body by such precision treatments. And these have also actually reflected upon the decrease in the number of side effects, the duration of treatment, the long term side effects also probably will be becoming lesser and lesser, because we are more targetedly treating the disease and trying to allow the child or the patient to grow and develop normally.
Definitely, there are a lot of changes. So, nowadays majority of the even pediatric cancers are curable. So, they are able to live their life normally and carry out the normal routine work. As we know that there is an increase in adulthood cancers, and even adult cancers are treated by targeted therapy and immunotherapy. There is a lot of buzz about this immunotherapy. Let me ask Dr. Abhaya that what are the cancers where we use this targeted therapy and how it has really changed the lives of patients?
This decade is of immunotherapy and targeted therapy. So, if you go back a decade, so we had hardly few treatment options other than surgery, chemotherapy. So, the chemotherapy is associated with lot of side effects. So, as we know that chemotherapy directly kills the malignant cells, and also it will kill the nearby cells. Because of that, it will try to kill the all fast growing cells, because of which lot of side effects. So, thanks to the field of molecular oncology, so because of lot of advancements in the field of molecular oncology, so now we are able to dissect out that molecular pathways, what are the molecular pathways which are responsible for the development of cancer. And they not only just identified the pathology as a molecular pathology to identify the cancer. So, these molecular alterations we can target it. So, by targeting these molecular alterations we can treat the cancer, what we call it as a targeted therapy. So, in scientific term we call it as a precision oncology. So, in general common terminology we call it as a targeted therapy. So, targeted therapy is not very new. So, one of the best targeted therapy till now is that we know about the imatinib. So, imatinib which is used for the CML, chronic myeloid leukemia. So, we know that once upon a time chronic myeloid leukemia was difficult to treat disease, but with this simple tablet called as a targeted therapy called as a imatinib. So, it is anti-BCR-ABL1 targeted therapy which targets against this BCR-ABL1 translocation.
It has completely changed the scenario from a not curable disease to a completely curable disease, that too with a minimal discomfort to a patient.
Yeah, so we are seeing that patients with 15-16 years follow up also without any much side effects. People are taking the tablet at their home without much side effects, without much toxicity, and with minimal bare minimum cost. So, these kind of targeted therapies, after that once we found that it is beneficial in the blood cancer like CML, they tried again to look for these multiple various targeted pathways, alteration of these pathways in various other malignancies. They found multiple targetable pathways in different malignancies, especially consider like lung cancer. So, if you see the lung cancer, earlier patients with stage 4 lung cancer, the survival with stage 4 it is only 6 months to 8 months. But nowadays they found that multiple targetable mutations in lung cancer like EGFR alteration, ALK alteration, ROS alteration. So, now with these targeted therapies we have converted this stage 4 disease into like chronic diseases. So, earlier hardly 5 years survival was less than 10% in lung cancer. Now, even with stage 4 patient we are able to see around at least 30-40% patients are surviving beyond 5 years. So, this is all happening because of the precision oncology, that is targeted therapy.
True, because I have seen patients in lung cancer or renal cell carcinoma and all these cancers where we use targeted therapies. It is just a simple tablet majority of the times, and patient can take this treatment at home, and side effects are definitely far lesser than compared to the chemotherapy. So, definitely it is a blessing for a patient. Definitely we are coming out with new treatments because genetic mutations are identified. We know where to target, which is the mutation which is responsible for this cancer. So, go and directly hit that mutation or block that mutation, so that we can cure this patient. So, because now peritoneal surface malignancies, as we know, when there is a spread of cancer, for example, appendicular cancer, ovarian cancer or colonic cancer, when it spreads to the peritoneum in the tummy, previously we used to label them as incurable, stage 4, but now we are able to cure them. That is, we resect the peritoneum completely, peritonectomy, and we give a special treatment. The improved version of treatment is HIPEC, hyperthermic intraperitoneal chemotherapy, where the chemotherapy is given at an increased temperature of 41.5 degrees Celsius for about 90 minutes. There is a special machine for this which is FDA approved, and this has produced wonderful results. Now, let me ask Dr. Abhay, where all we use this HIPEC so that quality of life or the overall survival improves and recurrence rates comes down. Which all cancers we are using this HIPEC in our facility?
See, HIPEC basically is done in patients with, so where the disease will go into the abdomen, that is where it will spread into the peritoneum. So, especially diseases like ovarian cancer and primary peritoneal malignancy, basically these are the main two indications. But recently, so doctors have started using in other different malignancies like, so they are using in the colonic malignancies also, they are using HIPEC.
So, basically appendicular malignancy, primary peritoneal malignancy and ovarian malignancy, which is very commonly used, and some other cancers where there is a peritoneal limited malignancies, this has been experimental in use and it is producing better and better results. Now, we also hear, I asked Dr. Vinay, who is a pediatric specialist. So, we also hear a lot of bone marrow transplant related and genetic therapies which have come recently on the news that it was a very costly treatment and all that. So, how effective are these bone marrow transplant and genetic therapies in pediatric malignancies, and how where we have come far now?
Bone marrow transplant world has changed a lot in the last 2 decades. It has been happening for over 3 to 4 decades now, but especially in the last decade, the outcomes of bone marrow transplant has improved a lot. So, previously we used to select patients for bone marrow transplant only if there was a fully matched donor, a donor who can give a healthy marrow to a patient who is having an affected bone marrow. But right now, every house, every household or every father, mother, everyone can be a donor, because we are able to perform even bone marrow transplant in half match setting, that is called haploidentical transplant. Okay. So, that has been a major barrier before, a decade ago as well.
So, don't have to completely match.
Completely match. This is because of the innovative immunosuppressive medications that have come. The technology is really great now that we can actually do a transplant from a half matched individual. So, in malignancies, especially childhood malignancies, bone marrow transplant has given a lot of hope for children who are not curable with the usual lines of treatment like chemotherapy, radiotherapy. Name a few, something like blood cancer, one abdominal tumor called neuroblastoma, and sometimes some lymphomas, refractory lymphomas. Bone marrow transplant has been the only curative option. As you told, the new innovation is cell therapy. Cell therapy is something that is similar art like a bone marrow transplant, where the stem cells are engineered to have a immunologically effective cancer killing kind of a mechanism that is installed. So, this is something called chimeric antigen receptor T cell therapy. It is a immunotherapy, but it is done in a way that a bone marrow transplant is done. So, these have been very effective world over. It has been there. In India, there are at least at 2 or 3 places we are doing it now, and definitely in years to come it will be available to most of the patients, and we can avoid long term side effect causing chemotherapy kind of medications and replace it with cell therapy, which is like a bone marrow transplant.
I have heard this, like pediatric patients getting a bone marrow transplant and having a normal life later on. How long means, what I want to know is, with this advanced treatment of cell therapy and all that, how effective it is, and can a child lead their normal life, and what about their growth in a long term lifespan?
Yeah. So, bone marrow transplantation, the treatment aspects includes chemotherapy, conditioning or radiotherapy, but it is all done in a protocolized manner where the side effects are lesser, and children are, in contrary to usual understanding by the society whether children can tolerate therapy or not, actually children tolerate treatment better than adults because they do not have other comorbidity or disease like diabetes, hypertension. So, they will be able to handle the treatment better, and bone marrow transplant in children is like a one stop solution. Usually the kids who do well, grow well, and they are having their normal healthy lifestyle.
Dr. Abhay, do you want to tell regarding the recent shift or change in the management of cancer care, considering the increasing statistics?
So, this decade is a field of immunotherapy. So, now there is no malignancy without any immunotherapy indications. Almost all malignancies now we are using immunotherapy. So, immunotherapy is little bit different than the routine chemotherapy. So, immunotherapy is basically, they are also a medicines only. So, intravenous medications, but their mechanism of action is little bit different compared to the chemotherapy. As I told earlier that chemotherapy directly going to kill the cancer cells and associate with lot of side effects, but this immunotherapy, so specifically we call them as checkpoint inhibitors. So, they basically what they will do is that, so in malignancy there is an immune evasion mechanism will be there. So, these checkpoint inhibitors, they will stimulate our body immune cells. So, our body immune cells, they are going to kill the malignant cells. So, this is how the immunotherapy acts. So, because of this immunotherapy particular mechanism of action, they are also a type of like targeted therapy, like we call them as a PD-1 inhibitor, PD-L1 inhibitors. So, this is because of this they have got a less side effects, but the only major present issue with the immunotherapy is the cost. So, as of now they are more expensive. So, immunotherapy has come up in almost all malignancies. So, with better results compared to the chemotherapy. So, now we are moving more away from the chemotherapy. So, we are using immunotherapy either single agents, we are combining with targeted therapies, and we are combining with the chemotherapy. Initially we started using in advanced setting. So, now we are moving towards the early settings like adjuvant setting, neoadjuvant setting. So, the beauty of immunotherapy is that the patients in whom immunotherapy is going to work, the response is more prolonged. So, even if we stop the therapy, the response will keep on persist for longer duration of the time. So, that is more beauty of the immunotherapy.
Yeah, that is very nice to know, because if at all response is for a longer time, then the definitely recurrence rates will be less. So, what has happened over a period of time in the recent past is, because of this advancement in technology, immunotherapy, targeted therapy, genetic therapy, we are able to cure majority of the patients when they come in early stage. This is most important, because cancer incidence is increasing right from the causes. We are able to identify the causes. For example, now cervical cancer, we never knew that it happens because of human papilloma virus infection. Now we know the cause, so we are able to prevent it. We have a human papilloma virus vaccine which can be taken, for example, 2 doses from 9 to 14 years, and if at all they are above 15 years, then 3 doses. That will prevent cervical cancer up to a stage of 70%. So like that, we know that like tobacco or alcohol are related to so many cancers. We should avoid, because as described, tobacco causes 19 types of cancers and alcohol is related to 9 type of cancers. We need to decrease the use of that. Definitely we should avoid it. And coming to the diagnosis or screening method, we have a lot of advancement in detecting the cancers at a very early stage. Breast cancer, which is most common cancer in a female, with the advent of digital mammogram, we are able to identify when the lump is not at all palpable. So we have a HPV test and pap smear combined method which can identify cervical cancer, or even before that develops, we know that there is a high risk of developing a cervical cancer and we advise them the precautionary method. Likewise, in the treatment also, as you have heard from my colleagues, Dr. Vinay and Dr. Abhay has spoken in a length about the advancements in targeted therapies and immunotherapies. Likewise, even in surgery, we have, as I said, robotic surgery, which is we have moved from the incision to precision and HIPEC, where we are giving more effective treatment at a lesser side effect, and chemoport insertion, and sentinel lymph node biopsy, where we are able to avoid the dissection of complete lymph nodes, so that there is no morbidity of lymphedema. So there is a lot of paradigm shift in the change of management, and because of genetic tests which are available, we are able to identify the high risk family members and we are able to advise them that the preventive methods. So it was a wonderful talking to our colleagues Dr. Abhay and Dr. Vinay. Thank you so much. I hope this the newer methods and the identification of causes and the preventive methods, the vaccines and the screening methods are going to help our population in a large number, and we are going to come up with a more healthy society in future. Thank you.